All right, good afternoon, everybody. It's 1 o'clock, so this is Jeff Jelnick. We'll get going here. I just want to thank everybody for being on there. Again, we will take questions via chat. There will be no audio type questions, so if you have anything, you can put that into the chat box. Unfortunately, we have Board of Health at 1:30 today, so there's several of us that have to be in that meeting, so we will try to get to as many questions after the presentations that we have, and if not, we will put the email address out where you could write your questions into us, and then we could address them at a later time. So with that, I will turn it over to Jody Molitor, who's going to facilitate our discussion.
All right, good afternoon, everyone. We're going to start with Jessie Phelan right away, and she's going to give us an operations update.
Sorry, trying to unmute there. One big thing that we wanted to update everybody on, and you may have seen this on our Facebook page, is that we have had to change operationally how a lot of our positive cases, unfortunately, due to the high volume of cases present at the end here. So the nuts and bolts of what will changing with how we handle those positive cases from the public health standpoint is if you are tested at our testing sites here that we run in Sauk County, you will get a call from the nurse or the disease investigator, just like we've always been doing. Unfortunately, we are not able to also handle the volume that is coming from the area providers. The providers' offices and clinics and hospitals are aware that this is something we've had to hand back to them, unfortunately. And so basically, as you'll see what Siobhan has posted here, or Sarah rather, thank you, is kind of what to expect. Once there's been, 5 days, you contact either the health department or your provider if you have not already heard of the result. We are doing the best we can to keep up with these as quickly as possible, and just realize that that's where your information will be coming from, depending on where you got tested. So, if there are questions about isolation and quarantine, based on where you were tested is who you should follow up with. We have asked the healthcare partners to please try to manage those patients that they have as best they can themselves with regards to education, isolation, and quarantine guidelines, and we will do the same with those folks that have tested through our testing sites. This is not ideal, but this is what we've had to resort to because of the volume of cases. So that's the biggest change we've had here at the health department this week.
Okay, thank you very much, Jessie. Jeff, do you want to give us an update on how the schools are going and any changes we might have there? Kathy, I think you're muted.
Yeah, Jeff, you need to unmute.
There we go. We're having a little mouse issue here. Related to the schools, I know we've talked about this on calls before. We've met with the schools last Friday, and we've agreed upon a metric percentage where we will engage the school to get a little bit more information. So Siobhan has put that up on the website so individuals can take a look at that. But ultimately, what it boils down to is looking at students or staff in separate categories. We look at each individual school. So it's not looking at a school district, it's not looking at the county as a whole, but it looks at each individual school. And then when we get to a 10% of a student that has COVID-like illness and quarantine, so 10% of the student population with both of those, that's the time, and we're engaged already, but that's the time where we talk with the school in a little bit more detail to find out what's going on, what can we do to mitigate, or is it time to where we would recommend that we go to a virtual setting for 2 weeks, or what we refer to as minimal capacity. Same thing for the staff. You can see the document here. Same thing for the staff. So if it's at a 10% of staff at critical COVID-like illness and quarantine, then we talk to them. So we have had a few discussions with schools in the last few days related to this, and it seems to be working well right now. At least it's a good guidance document for us to keep engaged with our school districts. And they've been, school nurses have been outstanding in keeping us notified, as well as the school administrators. So we will continue with this. Again, this is a living, breathing document. So as we come upon new things that we haven't thought about, there might be some small tweaks to this. But as of right now, this is the document that we are using. So just wanted to get that out there. I know there's been a couple questions on the calls in the recent weeks. And now that we've got this finalized, that's where we're going. So thank you, Jody.
You bet. And Siobhan did put in the chat, for those who may be on the phone, that you are able to see this school document on Sauk County Public Health's data hub. So if you're looking for this information, please feel free to search that out on our website. With that, we will go to Siobhan next with the data.
Okay, found my mute button, and trying to share and have multiple screens open at the same time is more difficult than you would think. Just give me a second to put the data hub back up on the screen. Okay. So as of today at noon, our cumulative case count is now 2,227. So that's the number of Sauk County residents that have had confirmed cases of COVID. As we've been talking about on this call, we've seen a pretty big increase in the month of October. And unfortunately, these trends are continuing, and they're really concerning. So it took us just under 7 months to reach 1,000 cases in Sauk County, but it only took 31 days after that to double our case count to 2,000 cases. As of today, our doubling time is now down to 29 days. So if this trend continues, it means that between today and December 4th, 2,227 more Sauk County residents could be infected. If the hospitalization and the death trends that we saw in October continue, we could see over 50 new hospitalizations and 6 new deaths due to COVID over the next month. So our 14-day data, which I'll scroll down to on our data hub here, is not really that good. All but one of our metrics are currently in the red. In Sauk County, and in fact in the entire state of Wisconsin right now, every county is experiencing high COVID activity. Sauk County is also experiencing high COVID-like illness, and we're also experiencing elevated influenza-like illness. So again, on the data hub here, you can select the county in this little drop down here, and it will tell you the case activity, the CLI activity, and the ILI activity. Over the 14-day reporting period, we've had 648 new cases. Our percent positivity is also unfortunately going up. Our percent positivity is now up to 12.5%, which is the first time that we've been in the red for that metric. So of all the tests conducted in the past 14 days, 12.5% of them were positive. Our lab timeliness is also not very great. Only 63% of our positive lab results were received within 2 days of test collection. Like Jesse had talked about, our health department has really reached capacity. In early October, we were unable to do complete contact tracing, and with the influx in cases recently, so especially in the past 7 days, in which we've averaged 59 new cases per day, we're now no longer able to call and complete a disease investigation interview with every single person who tests positive. So in the last 14 days, we were only able to interview 67% of new cases within 1 day of receiving their test result. Now, eventually, 3 out of 4 cases were interviewed, so we were able to complete some more, but we expect this number to actually decrease in the coming weeks as we're not able to reach out to all of those cases. So being unable to complete a disease investigation interview is concerning because without timely disease investigation interviews with positive cases and thorough contact tracing, we can't ensure that those people who are sick are isolated, and we can't ensure that those people who've been exposed are quarantined. At this point, we're no longer controlling the spread of COVID-19. So COVID is actively spreading throughout our communities. Of our cases with completed interviews, 38% were community spread, meaning that they were not connected to a known case. So again, because we didn't have the capacity to complete disease investigation interviews on all of our positive cases, this metric is calculated using the information from those cases that we were able to complete our interviews with. So on a more positive note, however, if you scroll up on the Data Hub, you will see that our testing level is in the green. We do have a really high level of testing, and that's thanks to the incredible efforts of our local fire, EMS, and healthcare testing sites. We conducted over 6,600 tests in the last 2-week period. Other data that we look at, and that is available on the Data Hub, if you scroll to the section on demographics, we do have, again, the demographic data, which looks at the demographics of those with cases and those that are hospitalized. We're continuing to see disparities in our cases and in our hospitalizations. Our Hispanic and American Indian and Alaskan Native residents are overrepresented in cases compared to their representation in the overall Sauk County population. And our Hispanic, American Indian, Black, and Asian residents are overrepresented in hospitalizations compared to their representation in the overall Sauk County population. Now, while most people who are infected with COVID experience mild symptoms and are able to recover at home, this is not true for everyone. And we're actually seeing all ages hospitalized. The Data Hub has been updated, the ages of those hospitalized chart, with the count of people hospitalized by age. And as you can see, 8 Sauk County residents under age 30 have been hospitalized, and overall 40% of our people that are hospitalized are under age 60. In the month of October in particular, 27 Sauk County residents were hospitalized for COVID. That's 1 person hospitalized every 28 hours. Also in October, 3 people lost their lives to this virus, and we've already recorded another death in November. Now, I really like to remind people that each of these cases is a person. This is a fellow Sauk County community member. They're our friends, they're our family members, they're our neighbors, and our coworkers. So I really would like to remind everybody and everybody here at Sauk County Public Health that we all need to work together to stop the spread of this virus. We're depending on the individual actions of our Sauk County residents. We all need to do our part to protect ourselves and others from this virus. If we can, we need to stay home. If we must go out, we need to maintain 6-foot physical distance from people that are not a part of our household. If you're able to, wear a mask when you're in public. We need to frequently wash our hands and disinfect commonly touched surfaces. If we start to develop symptoms, we need to isolate from others and get tested. We need to self-quarantine if we've been in close contact with someone with COVID. And with the large amount of community spread, we need to avoid gatherings. So please, everybody, be a leader in your circle. Talk to your friends and your family about the importance of COVID safety precautions. Challenge misinformation. Share helpful resources. Remember that you can have and spread COVID-19 without knowing it. The safest way to think about it is this: act as if you have COVID-19. Don't do anything you wouldn't do if you knew you had COVID, because the reality is that you might have it and not know it, and you could spread it. You could be the reason that your family, your friends, your coworker, really anyone that you interact with gets sick. And none of us wants to do that to our fellow community members. So together we need to work to reduce the spread of COVID. So again, if you have any questions about the data, we do have an email address in, and you can see all of the information on the Data Hub too. Thank you. Anybody else have anything to add to that? Sorry, I got a little emotional. It's starting to hit a little close to home.
Thank you, Siobhan. That is definitely a message that we all here, especially at Public Health, are taking very seriously. And like Siobhan said, it's really starting to hit home, and it's getting very heavy here. The other
This is
thing,
Jesse. Can I throw something in just on the tail end of that?
you go right ahead.
Because we are struggling to keep up with cases and we know that the hospital staff are as well, please, if you test positive and you get an email or you get a phone call, please let your employers know, let your close contacts know. And then also if you have a child in school or you work at school, please let the school know as well. We all need to work together, like Siobhan said, to help mitigate this and help slow down the spread. We can't do it alone anymore. We really are relying on your help. So employers, schools, close contacts, if you test positive, please let them know. And if we've already gotten to them, great. They'd rather hear it twice than not at all. So that's my last little tidbit on that.
Okay, thank you, Jesse. And then coming from me in planning, and following up with what Siobhan said, we are not able to reach all of our positive cases that we have now. Things are getting worse, and unfortunately, we see the holidays coming upon us. And so with what she said, our recommendations, our messaging will be in the coming days here. Stay home, act like you very well could have COVID when you're planning your holiday preparations. This is not the time to be gathering the family together. This is a very hard message for us to send out. But in order to keep all of our loved ones, all of our friends and neighbors healthy, we need to ask that you stay home and celebrate the holidays a different way this year. This is going to be the year to make new traditions, to try new things. And we're just asking all of you to work with us to help us have the holidays be a new and cherished time for us all by trying new and different things. With that, I think we're going to go to the chat with any questions. Siobhan, did you want to go ahead? Let's see. Actually, I do not see any questions, I believe. Oh, one just came in from Carol. Siobhan, you want me to take those or?
I got it. I can take questions. Okay, so from Carol, we have, what is the plan to get the community spread under control? Obviously, nothing is working and it's getting worse. How do you stay home when you're sending teachers, staff, and kids to school every day and all businesses are open? Why don't you close down for a bit before more lives are lost?
Well, thank you for the question. And I mean, again, as we've talked in these previous calls, we unfortunately do not have the authority to shut anything down. So what we're trying to do is trying with the contact tracing, at least to notify the cases that we have tested so that we can let them know to notify others so that they can quarantine or isolate depending on if they're ill or not. But the county, it would be the county board that would have to invoke the powers to the health officer to close down businesses, schools, and ultimately, from looking at businesses as well, there's a lot of businesses out there, unfortunately, that I don't think would make it. So we're really need to look at this as from a big picture view, and how can we do things safely? How can we do things where we're following the proper protocols, social distancing, masking, and still continue on with the COVID life, I would guess we would call it right now. So unfortunately, there's not an easy answer to this. There's a lot of other variables that go into just shutting down schools or businesses that need to be looked at as well. That's the thing that we struggle with on a daily basis.
Okay, we have.
Hi, Tom Kriegel here. I want to remind everyone that this is the greatest threat to public safety that any of us have ever experienced. If I understood the numbers as presented earlier, 3%, we've had a 3% infection rate in the county. And of course, early on, they were projecting like 1% or less, kind of similar to the flu. We've had 8 deaths so far. Okay, we average 1 to 2 murders a year in the county. And every time we've had murders in the county where we've had everybody out upset and taking extraordinary measures. And here we have 8 people who have died from a preventable cause. And of course, our governments at all levels, local, our county board, our city councils, have failed, and so has our state legislature and our Congress, to impose better practices and more resources to this greatest threat to human safety in our lifetime. And yes,
Jody, you are muted. Jody, you're still muted.
Can you hear me now? Okay, I muted Tom there because of in the interest of time, like Jeff said, we only have so much time and we are only taking comments via the chat. So if we're going to address the next question here, Jeff Wright is asking if public health has crafted a statement about Thanksgiving recommendations that we could include in school newsletters and other messaging, excuse me, to community members. And Jeff, that is actually something that we are working on. Hopefully we will have that out tomorrow. I'm hoping have some messaging out for you. And if not, for sure by Monday. Siobhan, you want to address the next question from Tim there?
Okay, our next question is the Board of Health talking about changing the county ordinance to better address communicable disease today? Jeff, do you want to take that one? If so, you're muted.
Yep. Yeah, it is on the agenda for the Board of Health today to just go on further discussion.
And Siobhan, there was an earlier question as well about how our healthcare partners are handling the follow-up on positive cases at their facilities.
This is Jesse. I could take that, although I really don't know for sure how it's going for them. I have not really heard any feedback. I can imagine it's challenging for them. They're already busy, doing other things as well, taking care of non-COVID things. So I can only imagine that it's very challenging. But again, I have not heard that specifically, so.
Okay, the next comment from Paul asking to please make the comments that I shared earlier public, and we will be posting the recording for this call later today so that it can be shared. And if you'd like to share it with your friends, your circle, that would be great. Okay, we have another question from Carol asking, what exactly is the plan? I think in reference to what we can do to encourage people to stay home and to follow recommendations. And Carol's saying yes to that. And at this point, Carol, it's really individual responsibility. So sharing the message that it's up to people's individual actions to continue these preventive measures. And we all really do need to work together here.
And Carol, this is Jeff. We also met this week, a group of our public information officer and a few others with the state, Wisconsin Emergency Management, with their 2 public information officers to talk about different strategies we could use for messaging to try to get those folks, we're getting, our message is getting out there, but we feel that it's getting out just to a certain group and they're continuing to get it. So what could we do, different strategies that we could do to catch attention of others that may not be following as closely or not paying attention as much. So there are some new strategies. We had a meeting yesterday on that internally, and it goes along with what Jody was talking about with the Thanksgiving holiday coming up. So we are going to be sending out some additional social media and media clips and releases to public service announcements to try to grasp and gain the attention of some of those that we might not be getting at this point.
Okay, we've got another question from Scott asking, what is the county board going to do to help change course? Jeff, you're muted still.
It really will be with the Board of Health. That's the discussion is on there today for that with the Board of Health. And then from that point, the supervisors would have to come together and address that at a county board session. So it's really that discussion starting today.
And speaking of Board of Health, that starts in 5 minutes. So we've got just a couple more minutes to answer some questions. We do have a question from Connie saying, speaking as part of outpatient clinic provider, we're pushing forward. Just like the county, it becomes overwhelming to find the space, staff, and time to address the urgent needs, as well as the education to our patients regarding their test results. I feel if there ever was a we're all in this together, it would be now. And there's another comment saying, to be fair, public health can only do so much. The reality is that leaders need to use their influence to encourage change. All right, any other questions? Please feel free to use the chat. Okay, we have another question from Janine. Janine says, several businesses in our area have voluntarily shut down out of concern of the health of their employees in the community. Many are going to curbside only. I wonder if there's a way to help people understand that their individual actions are impacting healthcare systems, school, and businesses, and the livelihood of those that work here. Thanks, Janine. We'll add that into our messaging and, encourage that, do curbside, do takeout. There's lots of ways that we can all support our local businesses through these times as well.
This is Jessie. Can I just throw one more thing out here? If there are any people out there on this call that would ever be interested in becoming a volunteer to assist at our testing sites, and sometimes, it's just helping with registration or traffic. It doesn't necessarily have to be any hands-on stuff. We are always looking for people to fill those roles as those lines are getting longer every day. So Siobhan, would you be able to throw Joyce's email into the chat? And Joyce Smittle is one of our people here at the health department who has been helping coordinate volunteers. So if you're looking to help out in some way, that is one thing we can have you do. And there may be other things as this unfolds. So feel free to, send Joyce an email and let her know that you'd be interested. Thank you much.
And Joyce's contact information is in the chat there. So if you're able to volunteer, please do so. Okay, I think we're caught up with all of our questions here. One last question from Laura asking if we've heard if funding is going to be available for the free testing sites.
You can unmute me. Hi, Carol. It's
Laura.
Laura, sorry. As of this time, we have not heard. We've been in contact with the state public health, Department of Health Services, and we're continuing to monitor that. There's a possibility that it might be, but at this point right now, we have, as of November 15th, that is the end date at this point.
And Laura's asked a follow-up question of our backup plan if the funding runs out.
Now, we have worked with some of our EMS providers are still going to continue to do them, not all, but some of them will. We might not be at the total testing that we are doing right now, but there would be testing available throughout part of the county on certain days. So there'll be more information coming out there. We're really trying to get a hold of that funding source and been in constant conversations with the state, and are hoping to have some better information here within the next week. So we'll have a little bit more detail there, but we've met this week with all of our providers that are doing testing, and some have stated that they would like to continue providing that service. So we definitely will have testing, maybe not to the magnitude that we have right now, but there will be testing available.
I really want to say thank you to everyone for joining us today. We really do appreciate all the positive comments in the chat, and that we're hearing. We really do ask for your help in sharing our public health message. because without all of you helping us spread the message, it doesn't get out there as we need it to. So wear a mask, socially distance, wash those hands, and please stay well. Thank you, everyone. We'll see you next week.